Welcome to Aging on the Suncoast. I'm your host, Jason Martino. The National Alliance on Mental Health reports that depression is the leading cause of disability worldwide and is a major contributor to the global burden of disease. They further report that 60% of adults with mental illness did not receive mental health services in the previous year. Just as intriguing, African Americans and Hispanic Americans were half as likely to utilize mental health services compared to whites. These facts are startling, and we owe it to ourselves to understand mental health much better in order to thrive as successfully as we can. On today's show, I've invited a couple professionals from Gulf Coast Jewish Family and Community Services. Kristina Jalazo, the Program Director of Elder and Disabled Services, and Nicole Guincho, the Regional Director of Behavioral Health, are going to help us understand mental health in older adults. So let's dive right in. Kristina, Nicole, welcome to Aging on the Suncoast. So obviously, today's topic is going to be mental health, and I think we should probably start by defining what mental health is. Nicole, would you help with that?
So mental health is essentially a condition that affects someone's emotional and psychological well-being. It can also affect how they manage daily stressors and how they think and behave every day.
Mm-hmm. So if somebody is having a hard time with mental health, they have a disorder or an illness, how many people are affected? How many older adults are affected?
So essentially right now, numbers reported to the World Health Organization say about 20% of individuals 60 and over are affected by a mental health disorder. However, those are reported numbers. We know that as it relates to stigma associated with mental health issues, that some people simply don't report those issues to their healthcare providers, or their healthcare providers aren't catching the symptoms of a mental health issue.
Thanks. That's good information. All right, so we're certainly talking about older adults and mental health and how that affects them. On today's show. We certainly know that children also oftentimes have mental health as well, and a lot of whatever symptoms that they're experiencing at the time as a young adult can transcend into their older life too. But a lot of times mental illness manifests itself in later life. Do you have any understanding of how it manifests itself in later life?
Yeah, so for older adults, it's twofold. Either they've had a condition that was diagnosed in a young age and it sort of comes back as they're going through the aging process, or what's going on in the golden years is affecting their functioning. So for instance, as individuals get into their 60s, they might get to the position where they're considering retiring. And so I don't know about you, but my job is a big part of my identity. And so they're having that loss of identity. And with that, as you age, you lose loved ones, maybe you're widowed, and so you're losing family. And so now you have the loss of identity and the loss of family. And then you continue and you go through this process and you're having physical ailments. Mm-hmm. And when you're having those physical ailments, maybe you can't engage in activities that you once enjoyed because physically you're just not able to. So now you have that loss. And most importantly, a lot of times they're losing their freedoms. So I know I've said to my grandmother at times, you shouldn't live alone anymore. It's very hard to care for this home independently. Yeah. Why don't you come live with me? And so for them, that's difficult. That's their identity. That's their home, their freedoms. We take away their car keys and say, we'll drive you to the doctors. And so it's not surprising that they're going to develop possible depression and anxiety as a result.
Depression and anxiety. Well, first off, great point about the loss of independence. A lot of the people that we serve within Pinellas and Pasco County, they're on the verge of losing their independence. That's why we put a lot of different services in place, because those constructs can have them remain home. Depression and anxiety. You hear the word depression all the time. I think it's helpful for our audience to just understand what is depression.
So depression is essentially a mood disorder, and it's characterized by just severe and persistent sadness, and maybe they're losing a zest for life.
Okay. And about how many people do you know that this really affects in the older adult?
The World Health Organization numbers reported are roughly 7%, but it's also going underdiagnosed.
That's an amazing amount of people that are doing it. But the underdiagnoses is pretty darn important too. 7% is a lot of folks, but if most people are underdiagnosed, then there's probably a lot more out there that are dealing with depression that maybe don't know that they have them. So while we're talking about depression, Certainly, a lot of these mental health disorders or illnesses have symptoms that go along with it. What are some of the symptoms? Feel free to expand on some of the symptoms that go along with depression.
Sure. So some of the things that you might be seeing or witnessing is isolation, and that's sort of in two components. It could be physical isolation, like maybe they're spending a lot of time in their room and not socializing with others, but there's also emotional isolation. For instance, I notice in my own grandparent, they would be sitting at dinner with us, but they're not engaging. They're almost just a spectator, and they're not sharing. So it's isolation of how they're feeling emotionally and whether they're engaged. Something that you can listen for in what they're saying is, are they questioning what their purpose is? Are they talking about their self-worth? That typically shows that maybe they're having feelings of hopelessness or helplessness. You're also going to see maybe a decline in their hygiene. Maybe you're noticing that grandma's been wearing the same clothing for 2-3 days, or you're prompting her to take a shower. And so they're just not motivated to do those things. There is also a symptom called anhedonia. And I know that's a very clinical term, but in layman's terms, it basically means that they've lost a desire to do activities they once enjoyed. So you might be used to seeing someone knit every day or go visit their grandchildren, and all of a sudden they're not picking up those activities or doing them. And that's a definite tell that things that once brought them joy, they're no longer finding that connection with.
Yes.
So those are the typical symptoms that you would see.
And when you and I were talking about earlier, we were reflecting on some folks we know that also had changes in their eating habits, and they weren't the normal intake of food that they eat was changing.
Right. So that's very unique because typical depression symptoms, sometimes people overeat, they eat too much. In the elderly population, they stop eating. You're often prompting them to eat. And the same goes for their sleep patterns. That can go either way. Either they're spending an excessive amount of time in bed or napping a lot, or they're having difficulty sleeping and or falling asleep, and so they'll bring that to a primary care physician as a medical symptom.
Well, that's a great illustration, and hopefully the folks that are watching the show will take a look at some of the ideas that you put forth and see if it either fits them or a loved one that they know as well. The other item that we talked about was anxiety. I hear about anxiety and panic disorders too. Can you help define what anxiety is?
So anxiety is a whole host of different diagnoses, but in its simplest form, it's just that feeling of excessive worry or unease all the time that doesn't go away.
That must be horrible, though, to constantly have that in the back of your brain that worrisome too. How many people do we know of that affects?
So essentially, individuals age 60 and over, we're looking at about 3.8% of the population. But this statistic is very unique because they are reporting anxiety symptoms, but they're reporting them as physical ailments like stomach aches and headaches and muscle tension. And so they're bringing those to a care physician, but they're being treated for the symptoms, not the disorder.
Well, that makes good sense, and that also complicates things sometimes as well. I can see that. So while we're talking about symptoms, please let us know what types of symptoms one would experience when they have anxiety.
Sure. So I'll start with the physical ailments. So I'm sure we've all heard the term butterflies in the stomach, and you get that usually as a performance method, but they're feeling that all day, every day. All activities, even simple activities, are causing that. And so they report a lot of gastrointestinal problems, but they're not relating it to the fact that they have anxiety. They think they have a stomach issue. The same happens with backaches and headaches. They identify that as maybe muscle tension, but really their nervous system's on hyper alert. You can imagine if you're in a car and you know you're embracing for an accident, you automatically tense your muscles. They're living like that all the time. They're in a heightened sense of fight or flight. Some of the other symptoms they're having are restlessness. You may notice that they're pacing a lot, or they're doing the wringing of hands like this, or their leg is shaking excessively. And so that's basically a way to expel additional anxiety. They also become irritable, and you have to really pay attention to that because what's happening is, since they're so on edge, when you're asking them a simple question, they might be very reactory and very quick to anger. And if that's not typical of Aunt Sally to snip at you, there's something going on there.
Yeah. she's dealing with some internal things. It's almost like fight or flight in some ways.
Yeah,
I
absolutely.
feel like that for that. So it's rough enough as an individual to deal with depression yourself. It's rough enough for an individual to deal with anxiety themselves. And we have a lot of seniors that live within Pinellas and Pasco County that do live alone and independently, and they deal with it without maybe professional support in the place. But a lot of our seniors live with either family members and or somebody that's devoting their time to care for that individual. Let's talk about the burdens and the experiences that some of the family members and caregivers are going to assume when they have an individual that they love and live with, dealing with either depression or anxiety or another type of mental health illness.
Yeah, when you're a family member living with someone who's already just simply going through the aging process, that in itself is a big burden to bear. You know, they need assistance with a lot of things. But when you layer anxiety or depression or some sort of mental health issue, it becomes emotionally tasking too, because you're seeing the progression of this illness. And so it can become very overwhelming. You might feel like you're prompting them a lot and trying to motivate them. For instance, if they have depression, to come out and engage with the family, and it can be very overwhelming. We always encourage our family members and caregivers to find a person who could be a relief person. Can you get a day off? Can you go out, take care of some activities, and maybe another sibling can come stay with grandma? The other part of that is there are support groups out there. There's caregiver support groups while you're going through this process, and there's mental health support groups through NAMI that you can just put in your zip code and look and find some support in your area.
Yeah, and NAMI is the National Alliance on Mental Illness. Could you expand a little bit more? A lot of our seniors, Kristina, you're no stranger to this, they have a lot of comorbidities going on. And a lot of times, if it's underdiagnosed, you'll be expressing a lot of attention to one negative factor of that person's life, but you don't know or you're forgetting about the other ones. A lot of times we're dealing with folks that are dealing with Alzheimer's disease or related disorder, and they may have mental illness in that. Can you expand a little bit more about that?
Yeah, sure. Any of the cognitive disorders, Alzheimer's or dementia, there's a lot of comorbidity with depression and anxiety. So what you're seeing are layers of different symptoms. So for instance, they might have wandering behavior and aggression, but in addition to that, there's fear and anxiety about going into the world. So there's all these layers, and that's very hard for a healthcare practitioner to essentially weed through. They're very cautious. They don't want to over-medicate, but they want to address these issues. And so really it's important to just get a dialogue out there so people can express what they're feeling, and that way it can be kind of picked through what needs to be addressed.
Yeah, that's a good way to look at it. And it's never easy. Like we said, it's tough on the individual, but obviously if somebody has a pretty major role in caring for that individual, they have to understand certain things.
I just want to add something. One of the other programs that we have at Gulf Coast is case management and homemakers, where our case managers will go into clients' homes, and they're taught to recognize different symptoms and what's going on in client's life. And if they feel that the symptom might not be medical, they are taught to discuss the issues with the medical professional or the family member or the client. We do talk about maybe offering them some counseling, some friendly support. And that's one of the things that we can also do. And
yeah, great point. And I think when we covered the second half of the show, we're going to go real far into a lot of the different services that you all can offer, either through some of the ancillary services or the direct counseling service that's there. But before, let's set the stage a little bit about there, because unfortunately, we're dealing with a very resilient population. Some folks have gone through the depression and they've lived a great deal, and they've dealt with things themselves. And as I know, and you can probably expand a little bit more, there's certain stigmas that are associated with counseling, and I'd like to get those myths out of the way now so we can really talk about the benefits of counseling too. Is there anything that you can share on that?
Yeah, I mean, what comes to mind is this generation of individuals, they're taught to regulate their emotions on their own. Yeah. That's something you don't ask for help with. If you're sad, you get yourself happy. And so there is a stigma associated with that. There's also the term, I don't know if anyone remembers the old term, being demented, but that is still prevalent. They don't want to be considered like they can't function or they're going to be institutionalized. So, you know, those are things that they consider before going and seeking help.
Yeah, so when we come back in the second half, let's finish that thought. And I'm glad you're on the show, Nicole, and please stick with us for the second half. And obviously you too, Kristina, welcome to the show, and stick around, okay?
All right.
Please stay with us while we take a short break. As usual, don't forget to have a pen or pencil ready. During the break and at the end of our show, we'll be running contact information for the Aging and Disability Resource Center Helpline, Gulf Coast Jewish Family and Community Services, and the National Alliance on Mental Illness.
James is 70 and a writer whose joint pain has been a story in itself. His doctor prescribed a new medication that may not be affordable, even with James's Medicare Part D plan. James called Shine. Shine volunteer counselors can guide you to money-saving prescription assistance programs, including a program that helps pay Medicare Part D plan costs for limited-income seniors. Shine costs nothing but could save you time and money. More information is available at 1-800-963-5337.
Welcome back to Aging on the Suncoast. During the first half of the show, Nicole Guincho and Kristina Jalazo helped us understand a lot about mental health and how it affects older adults. So, let's progress with this conversation and learn about some resources available to you within our community. Nicole, welcome back to Aging on the Suncoast, and Kristina, welcome back to Aging on the Suncoast. So we talked a little bit about mental health in the very beginning, and we talked about specifics that dealt with depression and what dealt with anxiety. And I always like to close our shows on the second half with the resources that are available on there. So Kristina, on a national level, what's a good, trusted organization that you would refer people to if you were talking to them?
On a national level, the good organization to go to is National Alliance of Mental Health Illnesses. They have all the needed resources locally for each state and each area, support groups.
And on the national level, they're a locator, are they not?
Yes.
Yeah, so they can kind of pinpoint you to different areas on wherever state you're at or whatever county you're at in there, too.
That's a good place to start with.
Oh, yeah. And you've worked for Gulf Coast Jewish Family Community Services for such a long time. Tell us a little bit about them.
Gulf Coast Jewish Family Community Services is a non-sectarian, non-profit, community-based organization that's been helping people of Florida for over 55 years.
55 years?
Yes.
That's amazing.
It's amazing.
Yeah.
They actually started in 1960. We started providing counseling and family support services to Jewish community in Pinellas County. And then in 1974, the agency was incorporated. That allowed us to diversify and expand our services to the community at large through public partnerships and public grants.
Yeah.
And now Gulf Coast has over 500 employees providing services to over 30,000 individuals annually.
And as an employee of the Area Agency on Aging, we've worked with Gulf Coast for such a long time. Yeah. We've always appreciated everything that you do. You're a very much a trusted partner with us, and we like doing that work. So, all right. So our first half we concentrated on mental health and mental illness. I think certainly we know that counseling is a major support for that too. Let's talk a little bit more about how counseling. You guys utilize counseling to help some of the clients that you do. You have a couple different types of counseling you can offer, correct?
Yes, we offer two different types of counseling, gerontological counseling and mental health services. Gerontological counseling is designed to provide emotional support, information for individuals, for older adults who are having a hard time dealing with aging-related issues. Gulf Coast has worked out an agreement with several community centers in a county that primarily serve elder population, so we can provide private sessions at their centers.
Oh, okay.
So providing services at the elder, one of the elder centers allows us to de-isolate and socialize our elders. We can also provide services in clients' home, at the location, in a Gulf Coast office, or any other appropriate location within the community. And then mental health services, they primarily focus on the unique treatment of psychiatric disorders in older adults, and including depression and anxiety.
Yeah.
And I can maybe have Nicole elaborate just a little bit on that.
Yeah, sure. So when they're with the gerontological counselor, if they identify a specific mental health issue, they might be referred to a counseling center to see a clinician, and therefore go through the process of developing new coping skills to manage this new disorder.
Okay, okay. So this show covers Pasco and Pinellas County. Does your counseling services also cover Pasco and Pinellas County?
Yes, we cover both Pasco and Pinellas County. In Pasco County, we do services mostly in clients' home or appropriate location in a community that's been agreed upon between the counselor and the client.
I think you've identified some important distinctions on where people can be served with counseling services, because not every location excuse me, is appropriate for whatever situation it is. A lot of times, from my understanding, that if a client may choose to receive services in their home because their mobility has been severely limited, where they can't get to certain spots like an office or maybe a community center or something of that nature too. But also, a lot of times an individual does not want to be receiving counseling services at home because they might have a conversation about the person that they're living with, and it might be inappropriate. So I think it's great that you have partnerships in Pinellas County and Pasco County where you can offer choices where that person can optimize their counseling sessions on there. So let's talk about the type of individual that's eligible for your counseling services. Can you take some time and explain that?
Yes. The eligibility process begins with a phone interview with one of our qualified intake coordinators, where they will triage to find the best modality for a prospective client's need. Our clients are 60 and over, living in Pinellas or Pasco County. If the wait list, if the spot is not available at the current time.
Well, you do run a wait list. Obviously, a lot of our services have waiting lists associated with them,
So if there is no spot available for to schedule a counseling session at the current time, then a prospective client is being advised of the wait list, and they're given an approximate wait time for the wait list. We also refer to our counseling center. And there are a number of organizations in the community where we can refer to for clients to get help, especially with psychiatric disorders.
Yeah, hold your thought on that, because we're going to go a little bit more into if we're able to do it by ourselves all the time, because I know for a fact we're not, but we'll talk about the different resources we can tap into. So for counseling, and for those that are age 60 and older, that's an Older Americans Act program, right? Okay.
Yes, it is.
And what would somebody pay for those counseling services?
The services are free.
They're free?
Yes.
Okay. Yes. Well, that's important to know, too.
Clients are given an opportunity to contribute, voluntarily contribute if they wish to, but the services are free.
Yeah, and when we were talking about wait lists a little bit earlier, there is a wait list for programs. Most of the services that we offer in the community, we just don't have enough funding to meet the entire need. So what we do is we outreach the community and we let them know about the cool services that we offer with whatever organization. But we also are honest enough to let them know that there are wait lists associated with some of these services. So I think it's fair for people to know. All right, so let's talk a little bit more about the private pay side of things, too, because I know Gulf Coast also works closely with the Area Agency on Aging for the Older Americans Act program, but you guys also have your own unique thing when it comes to private pay. You want to go into any of that?
We also have an outpatient counseling center where this counseling center accepts most of the insurance plans, including Medicare and Medicaid, and they have different specialties, including individual family counseling, psychiatric services, and medication management.
Okay. Yeah, that's important. And medication management is a big piece of that, isn't it? Yeah.
Yes. So I'll let Nicole talk about it a little more.
Sure. If you call our main line that I think was offered during the break, they'll transfer you to the counseling center front desk, and there's an intake coordinator there. So they'll take the information, and within 24 to 48 hours, they'll schedule you to meet with a therapist and have an assessment to determine the services that you should need.
Awesome. And you're correct. On the graphics, it's going to give information for your the URL or your website, and then it offers a number for the main number, and then also for the counseling center. So either way, that person is going to be looked at and probably triaged so they can get into the correct modality or both modalities to serve them. So let's go back to, can we do it alone? Because a lot of folks in our community need the assistance of counseling, but they might need the assistance of other things, such as Meals on Wheels or home-delivered meals. You want to talk about some of your partnerships and how you would help them out holistically?
Well, there are a lot of different resources available throughout Pinellas County, and thanks to you, Area Agency on Age, and different organizations we work with. When a counselor or a case manager identifies certain need, we do refer clients out to Meals on Wheels. We refer them to Neighborly Care Network Transportation Program. There is Gulf Coast Legal Services. There's assistance with utility payments.
The EHEAP program.
The EHEAP program, that's right, through Area Agency on Age. And so they are not in this alone. Once they have an individual from our organization or any other organization, our partners within the community, we will help them and we will link them to the resources that they need to help them get through this.
Yeah, and as a human, I would need to be served holistically as well too.
And not just them, but also their caregivers and their family members.
Yeah. So I'm gonna make myself an example of this. I'm 70 years old. I experienced some loss in my family, and I'm having a hard time dealing with that. And Nicole took the time to go over the symptoms. I watched the show. I feel like I'm dealing with some of those symptoms, and I decided to make a phone call to your agency. Can you tell me what I would expect when somebody picks up the phone on the other end over there?
Okay. So one of our qualified individuals, intake coordinator, they will triage to, they will do a phone interview and triage to see the best modality for the client. Phone interviews eliminate the need for the office visit, and that allows people who do not have access to transportation to actually start receiving services, get into the referral process, and that allows us to maximize the areas of service. So when we're able to schedule an appointment, we advise client that a counselor will contact them. The counselor will go and do an initial session for the intake where they will go through their personal information and their needs. And then they will determine a plan of action. They complete a treatment plan, and clients can be seen every other week or once a week or once a month, depending on their needs.
Yeah. To be fair to our public, you all are a busy organization. If somebody calls, are they always going to get a live person on the other line, or is there a way that they could leave a message to get a call back?
They can leave a message, and our intake coordinator will call back within 24 hours.
Yeah, and I guess I only bring that up because even in our helpline, we receive 22,000 calls last year on there, but I can guarantee that person, when they called, did not get a live person directly. But we always call them back within a very small time frame on there. So, Kristina, I appreciate you coming on our show today, and Nicole, bringing a lot of all your wisdom to the table and serving the folks of Pinellas and Pasco County very well. So, we hope you enjoyed this month's broadcast. We also hope this episode encouraged you to seek assistance through Gulf Coast Jewish Family Community Services. Together, we as partner agencies hope to ease the challenges you may face. We'll see you next month, and until then, seize every opportunity this year has to offer.
Soon it will be time to make important decisions about your Medicare prescription drug coverage. The Florida Department of Elder Affairs SHINE program can provide free, unbiased guidance in selecting a Medicare Part D or Medicare Advantage plan. If you have questions or need help, SHINE can guide you through the enrollment period ending December 31st. More information is available about SHINE at 1-800-96-ELDER. That's 1-800-963-5337, or on the web at floridashine.org.